so that I can have it easier for when I look at different things. And then I will upload it. Go back to sharing. Our agenda is a little different this month. Can you see my PowerPoint or not?
No.
No.
Now?
Yes.
Okay, good. Okay, so this is our agenda for today. So this is what we're going to need to approve. The minutes will have to be deferred to January, and we will send them out though. Hopefully by the end of this day, I will send them out. I have 2 laptops and both have kind of pooped out on me, but fortunately I've always ended up with one. Unfortunately, they don't have all the same programs on. So what I'm going to do, oops, it went ahead and did this, is ask for us to approve this agenda, which is deferring the minutes to January. I will give you an update, a summary of our 2021 and where we're at. Arida, I believe, was going to give us point in time reports and the System Performance Committee reports. And then actually Arida will be doing a presentation on how we do coordinated entry in our Racine CoC. And then we'll go to community sharing where you can share whatever you have. So if you haven't already, please sign in. And I am going to ask for a motion to accept the agenda, to approve the agenda. This is where someone says, I move to approve the agenda.
I motion to accept the agenda. This is Kim Leslie.
And I
Kim.
second it. I second it. This is Sharon Pease.
Okay, thank you. And now we can move forward. So now I am going to stop this, hopefully, end the slideshow. And I will put up what I have as a report for you today. So this is somewhat of an, you can see the Racine Alliance, the CoC Alliance, our work in 2021.
Yes, we can.
Thank you. Okay. So this will be a brief update of what we've been doing. So we had 3 initiatives. I tried to break this down into where they fit with the initiatives. The initiatives were designed prior to COVID. That messed everything up, but we still have made some progress. So I've tried to align them where they fit. So when we look at breaking the cycle of evictions, what we have done is we have provided some housing resources. We are working with WIDA to place 50 vouchers, so 50 households, into emergency housing vouchers. Those are run as Section 8 vouchers, which means they have been approved. We're selecting people that have been in our permanent supportive shelter housing. We are providing them with a move-on assessment to be sure that they can be successful in moving on to this. And then they are provided with some background through WIDA and accepted with a voucher. And then we also have a housing navigator that we hired. You'll meet her later on. And Becca is working with these emergency housing vouchers, and Arida has done a little bit of work with this as well to make sure all the paperwork is completed. This will free up, we're hoping 50 people, 50 slots in permanent supportive shelter and rapid rehousing combined. And then that will allow people that are on the waiting list for those, or that are in shelter, that are ready to move into those types of programs, to move through. So I put that under here because that's actually helping the people that are in need and helping us move people through. We've also developed we're developing a stronger relationship with the Housing Authority of Racine County. We have foster care youth to independence vouchers, and those are for youth who have maybe entering into or at risk of entering into homelessness, that are in a part of the foster care system. And so we are looking to get those placed. Those are on as we have someone who we believe qualifies, the COC will refer them to the county. The county does confirms their status, and then they are moved through to the housing authority that gets their voucher. And then they have a 2-year program to get all sorts of resources as well. And then we are also working with, I believe it's DHS, the Division of Medicaid, for ways to provide housing services through Medicaid. Let me see. And that you'll hear a little bit more about that later. So the collaborations then that fit with the, addressing the evictions are the collaborations for the WRAL, Wisconsin Emergency Rent Assistance, which is handled through Racine CoC Community Action Agency, with Here to Help through Racine County Human Services, and through Legal Action of Racine. And what's happening is people that people that are at risk of becoming homeless or have become homeless, especially due to COVID, they are able to get some assistance if there's a problem with the way the eviction is being processed. They're able to go to legal action and receive help there. Here to Help is some vouchers that they're able to provide, as well as other services that we have through Racine County, and such as, do they need energy assistance? Do they need food stamps? Anything like that. And the WRA program is for anybody to receive rent assistance, especially if they are facing an eviction and the problems are due to COVID. So we have, those are new partnerships that we've developed and strengthened. If we look at initiative 2, is overcoming stereotypes and misconceptions about homelessness. This has been a bit harder. Really what I've done is posted up here the presentations that we've done, at least through our alliance meetings. We've had Here to Help, the Financial Empowerment Center, the lead poisoning prevention, our system performance, families and transitions from Unified, the Racine CoC Black Nurses Association. We received some history about the work that they've done, and then also how we partnered with the Racine Vaccinate Racine project. We have the Racine's Rents Initiative presented to us, domestic violence programs. For that month, we had Women's Resource Center, we had the Fight to End Exploitation, and Catherine Marion Housing, which is Bethany. So we took a look at what goes on there. We've had October, we had our Experiencing Homelessness and what was going to happen, especially with evictions, and then winter weather plans as we've moved forward. And then no meeting in November. And then now we're looking at our coordinated entry process. While these are internal to us, I think that what I've heard from each time somebody has presented is that this has provided some information that people didn't necessarily know we had. So I am counting that as improving, and it's not necessarily addressing the homeless stereotypes, but we'll be working on that in the new year. Our work has consisted of committees and work groups. So these groups have met at least once. Coordinated entry, the diversity, equity, and inclusivity, HMIS, which is the Homeless Management Information System. And the, sorry, I keep saying, the Point in Time group has met. Prevention providers, we meet we were meeting with COVID, we were meeting once a week. Now we're meeting once a month to have a discussion about where things are going, how things are happening and staying. We have the rating and ranking committee that met and did a phenomenal job going through the applications for our Racine consolidated application to HUD, which is now in the pending stages. We're waiting on them. And then our system performance group has met. We have a seat at the table with the Division of Medicaid for planning and funding. We have the emergency system function, which was also FEMA. We meet once a week, bright and early at 8 a.m. on Wednesdays to discuss different ways, this is statewide, that we can provide information updates. We are also a part of forming their homelessness provider forum. That is a collaboration with the 4 CoCs plus the emergency system function. And we're looking at different ways to provide higher end training or at least open discussions. We've done mental illness, we've done a number of different topics. Our last one was for primarily people that were providers of homeless services on how they may be able to, we're looking at getting the ability to become providers of Medicaid services, which is including housing services. And so we had a bit of an overview, high-level overview of how to become a provider. We also have a seat on the Wisconsin Interagency Council on Homelessness, which is chaired by Governor Evers. And we are at the table for the Wisconsin Housing First Coalition, which I am the vice president. And we did our first training on engaging landlords. We have a number of training and sessions that will be coming out this year. So we have, and then the Vaccinate Racine Coalition. So we have a number of areas where we are participating, or where I am at least participating, so our presence is known. And I think that this will get stronger. I am still looking for people to be a part of, like diversity, equity, and inclusivity. The point in time is not taking volunteers at this point in time. If you're interested in prevention and how you are, if you're a provider and you want to, and you have a prevention aspect to your program, you can let me know and I will bring you up to the meetings. And then rating and ranking and system performance, we're always looking for participants to volunteer to be a part of those. That's the benefit of having this community organization. You are the social outreach of our CoC. You are the ones that are not necessarily funded organizations that give us the community well-rounded perspective that we need. And then we have initiative 3, which is maximizing housing impact. And for that one, we have been working with the Department of Human Services for Division of Medicaid. We are in the process of working through finding, getting some funding approved, and it has to go through the federal level and the state level. We'll position for housing navigator, a position for supportive services. These will be need-based substance abuse, people that have received Medicaid. They also have a substance abuse disorder, mental health diagnosis, or they pregnant or within pregnancy, postpartum 12 months from delivery. We're also exploring options for service providers, like I said, to become Medicaid providers, to bill for services provided to the homeless clients receiving Medicaid. So that, what that is this is our way of trying to expand what we are looking for with extra funding. And HUD has been gently nudging us to find ways to supplement the funding that we receive, because that's how we can expand it. So what I've done is I've shown here our collaborative funding opportunities, funding that we've actually received in 2019, 2020, and 2021. This is just the city ESG emergency shelter grant, the EHH, which is the emergency solutions grant, housing association assistance program, and the homeless prevention program, and they're all combined and are listed as the EHH. So what I've done is shown you what we've received. We've seen some some increases with our federal funding, and the zeros are because these are money that we received over and above because of COVID. So we have been able to bring in $6,006,342 to Racine through these grants. Now, just to kind of clarify here, if you look at what we've done, we had the 1.8 million from COVID funds. So what we need to do is look at, okay, there were some special situations that occurred that we quite frankly wouldn't have been able to get through, such as the increased need for motel vouchers because of having to separate people to provide isolation or quarantine, and and then to also to maintain the distance that people needed to be acceptable for not infecting anyone else, you know, the social distancing, excuse me. So, this is good, but this is something that we're going to be working on in 2022. Interestingly enough, we left money on the table this year. There was $94,000 bonus for the CoC competition that would have allowed us to partner permanent supportive housing with some
That's
type
okay.
of.
I just want to know for my records anyways.
Please keep yourself on mute. For provide PSH, permanent supportive housing, with medical services and medical providers, and kind of collaborating together. We did not have anything for that. We also left, I believe, $40,000 on the table for a DV bonus. And my hope is that we're going to get more organized. We've come a long way, but there's more that we need to do as an organization. And so this is my next section for 2022. We need a structure of the organization. And I believe we'll be pulling together the steering committee to have a discussion about this. We have no formal structure, regardless of whether we want to have 501 status. We need to have a structure. The elected positions that we have, excuse me, really don't oversee anything. There's no board. The CoC is mandated by HUD to have a structure of leadership, and we have that with the Leadership Council. But that group is struggling because of being so busy having the leadership formalized. We meet regular, but we have yet to get that president, vice president, chair, vice chair sorted out. So we need to have some structure. We can blend the two things together as long as we maintain the requirements that HUD has for a CoC portion. We can formulate how we want to have this structured for the alliance portion. And honestly, having elections every year becomes burdensome. And also it's burdensome because people don't always want to step up, and people end up being the chair, which I have no problem, or being the president, which I have no problem, for 5-6 years. I can do this. It coincides with my job. I have no problem with that. But we still, you know, we're very fortunate that Mary Beth has remained on as our secretary. We blended that with the treasurer position, and now we have Sharon Peasy, who has been our vice president and is retiring. So we're pushing the elections forward, because that's another thing that got lost in the defining structure. What does it mean to be a member? We had a membership group that has met. I didn't put that on there. I forgot about that. But a membership group that met, and a nominating committee that met. And the nominating committee needs the membership to meet to decide what it means to be a member. And the membership committee really needs the larger voice of the steering committee and this group to decide, what does it mean to be a member going forward? Do we have dues? We say we do, but we don't collect them. So these are things that we need to start focusing on to get our act together, so to speak. I also am looking for the CoC portion is to outreach from west of the I. We are primarily focused with funding through the city. We have Burlington Transitional Center that receives funding from some of our grants, but I would like to open it up to any areas outside Burlington, Union Grove, to the different areas that are west of the I. We definitely need to increase diversity, equity, and it's supposed to say inclusivity, all levels of the Alliance, the organizations that are a part of our funded partnerships, and the funded agencies, but then also the organizations that we belong to and our CoC and Alliance as a whole. And we need to increase the amount of people that have lived experiences, because otherwise we are just sitting around trying to make policies and structure things for them, which is just that, for them, without them. We also need to consider racial, ethnic, and different abilities, as well as the LGBTQIA population, and see where our diversity lies. We really need to have some position statements that we have on hand that everybody signs into, that states that we understand what exists and how we are going to be moving forward to, and are moving forward, and we need to have some standards and outcomes. I'm looking to try to increase the communication throughout the CoC Alliance. I am in the process of purchasing constant contact with our CoC funds so that we can put out the updates a lot faster and keep our membership, the people that we have on the e-list, a bit more coordinated. So that's a process that I'm hoping will help us. And then projection and plans is to increase understanding of our funding sources and dollars to be strategic with which types of projects receive funding. Scott Metzel and I have talked about that. We are looking at trying to pull together some groups, some people to have a serious discussion about where we're receiving our funding, which is what I showed you, and then just where do we need them, as opposed to these people all received funding last year for these particular programs. Let's just do it again and increase the amount that they're getting. With our housing navigator, we're looking at increasing the collaboration with the landlords and getting that moving through. The last big meeting we had scheduled was scheduled the week of the stay-at-home order from Governor Evers, so that kind of plopped that out. And then understanding category 2 and 3 needs countywide. And I have the definitions, and I'll go through them very quickly with you. These plans that I'm looking at do not override the initiatives that we had. They're designed to fit in and complement the initiatives. So I don't want anybody saying that I'm taking the initiatives and throwing them out the window. No, the initiatives are still good. We need to evaluate where we are with those, but we also need to fit these as priorities involved. They are impacted. They impact our organization and our CoC. And quite frankly, these are questions that were asked about on our funding grants. We should be doing them anyway, regardless of funding. So there are 4 categories that HUD defines. Literal homeless, that we're doing right now with the shelters. Imminent risk of homelessness, homelessness under other federal statutes. We do not work directly with those with our funding. And then number 4 we do, which is fleeing and attempting to flee domestic violence, which we could also add sexual assault, human trafficking. So this PowerPoint will be sent out. This meeting will be shared on the YouTube. And so you'll have an opportunity to go through and see what these mean. But the literal homelessness is people who lack fixed, regular, adequate nighttime residence and safe place meant for human habitation. And again, these will be up so you can take time to look at them. I'm not going to go through them completely. The category 2 that I'm talking about are people that they're not homeless. Their residence will be lost within 14 days of the application for homeless assistance, and they have no subsequent residence that's been identified. a lot of times we're talking about people that are house surfing, things like that. So we need to see where this is, because this is not a category that we have the ability to serve right now. And category 3 is we're looking at unaccompanied youth under 25 years of age. We do have the shelter safe haven that works for that, but we are also looking at these different situations. HUD has not authorized any COC to serve homeless under category 3. HUD determines and approves the use of COC program funds to serve the population based on our consolidated applications. So there's some guidelines there that we would need to meet. And honestly, what has come about is that the shelters have looked at this and said, you know, we have people that are category 1, and we really need to get people that are not at risk, but don't have a roof over their heads, and get them into shelter. And there's a limited amount of money. That's where we're putting it for. And also people that are fleeing domestic violence. So this is category 4. We do fund this. So I just wanted to give you and include this in the PowerPoint so that you are able to see this at a later date and get a clearer understanding of what's going on. My hope is that we will start with small groups and then eventually work our way through the larger population, have breakout rooms and Zoom, and have some good serious discussions as we're going through it. For our January COC, I'm going to give you the history of how it came to be that we're where we are today, from Mother Louise Hunter through where we are today, and give you an idea of how this has been set up as a system, and kind of pull us back so that we're not operating out of silos, that we're operating and understanding where we fit within the system that we have. So that's what I have for my report right now. I'm going to stop sharing here. And at this point, I need to end my PowerPoint. There we go. In our agenda, we are looking at Arida. Are you here? Thought I saw you. Where are you? There you are.
Yep, I'm here. Can you hear me?
Yep, we can hear
Perfect.
you. And so if we can, trying to get these, so I just have this view. If you could give us your statement on PIT and
Sure. Sure, no problem. So Scott generally provides an update in regards to what has happened so far with our point in time work group, which is a subgroup of the HMIS committee, the Homeless Management Information Committee. He was not able to attend today's meeting. He's the only one in the office today, kind of manning the office and doors. So I agreed to go ahead and provide this update. Point in time is when we as a community make our best estimate count of the people who are homeless in Racine County on that single night. So not only are we identifying the persons we're serving in shelters or transitional housing programs, but we're also doing outreach and identifying and doing a full census in the community of persons that are unsheltered, engaging with them, offering shelter, but also collecting data with their consent to get that capture that count. As well as capturing the data that's not in HMIS for service providers who are not allowed to. That would be Women's Resource Center and Bethany Apartments. There are several parts of that where we're also counting the beds that are dedicated and the capacity to serve as, for individuals experiencing homelessness, and reporting that it's called the housing inventory count. So that all is captured. HUD requires at least biannually that we have this. So January of 2022, our point in time will be held on January 26th. The point in time work group has met twice so far. We met on November 24th as well as December 15th. During historically, during the COVID-19 pandemic, Racine had temporarily discontinued our community volunteering in the point in time count and has been using the HUD's recommended strategy for leveraging existing street outreach teams. But this year, we're actually going to just include the street outreach teams as well as service providers to do that count. So we just want to make sure that the agencies who are interested in participating in the point in time count do reach out and send an email to Scott Metzel if you need a team to cover that night. So far, the participating agencies that have agreed are Halo, Hopes, ICA, and Safe Haven. There will be assignments and there'll be an orientation of that. And the next meeting, I believe, is, I should have wrote that down. It is January 15th, I want to say.
That sounds right.
Okay, January
pull it up.
15th. So please do, if you are an agency that is funded and required to do this by your MOUs, please do respond as far as your volunteering to man a team and do your street outreach count that night.
January 12th.
January 12th. Thank you. Sorry about that. I thought I
I'll
had
put that
written
in the
down.
chat.
Thank you. January 12th, and I believe it's at 3. Is it 3 or
o'clock.
3:30? 3 p.m.
3 o'clock.
And we do meet virtually for that. So please feel free to reach out to Scott Metzel. Can you also put Scott Metzel's email
Yes.
in there?
I will do
That
that.
would be great. Report template for the agencies that do not enter data into HMIS was sent out to those 2 agencies to report that aggregate data on that point in time night. So we are counting individuals for January 26th, 2022. Should I move on to the next agenda item?
Sure, your system performance.
Yes, system performance measures. So the federal fiscal year of October 1st, 2020 to September 30th of 2021 was our last federal fiscal year. We are reviewing the HMIS data on clients served and the performance of that. There will be, we have a committee that meets. We will be meeting next on January 10th from 11 a.m. to 12:30 virtually to review the draft data of our system performance measure for this last fiscal year and have a discussion about that before we have an official submission that is due on February 28th. Anybody interested in that committee, please email Scott as well, or myself, Araida.Vasquez at icalliances.org, and I'll throw that in the chat as well. If you're interested, it'll be a virtual meeting, and then intended for people who are interested in reviewing data. So we welcome you to that. Generally, we've met 4 times a year to review that data. There was a data migration process that happened this last calendar year in which we moved the data from one database to a second database, our current database. And so we weren't able to meet because data was actually being migrated, and but now we're ready to meet now that the data migration has happened and have those quarterly meetings resume. So looking forward to that. Any questions? Nope.
Nope.
All right. That is all I had for those announcements.
Do you need the screen for your presentation?
I sure do, please.
Okay. Whoops. One moment. I think I can do this. You should be set.
Okay, Seth did ask, what is the actual point in time date? It will be January 26th, the fourth Wednesday of January. Perfect, thank you. I should be set to share my screen.
It should be okay.
All right, are you seeing the coordinated entry system
Yes.
on your end? All right, perfect. And I just need to move my view here. Okay, perfect. All right, so I will introduce myself. I am Araida Vasquez. I work for the Institute for Community Alliances. I am the HMIS System Administrator for Southeastern Wisconsin, I should say, covering Racine, Kenosha, Waukesha, and Jefferson County. I also, for the Racine Continuum of Care, am overseeing the management of the coordinated entry system. I've been employed by the Institute for Community Alliance. We were designated by the 4 COCs, the HUD recognized COCs in Wisconsin, as the HMIS lead agency. Historically, a little bit about me is I've worked 15 years doing direct client service at Legal Action of Wisconsin as a paralegal, working with clients that were low income, most vulnerable clients under several different grants, providing assistance with family law, landlord-tenant law, public benefits, Social Security benefits, and securing those resources. The last 5 years, I've been working with the Institute for Community Alliance in my current position. And the last 3 years, I've been managing the coordinated entry system as well for Racine. So just a little bit about me. I don't do as much direct service provision now. I'm really here to support the agencies that are involved in entering data into our homeless management information system and managing the coordinated entry system and making sure onboarding and the data, the reports are all accurate and reliable to be able to use for offering services to clients in a prioritized manner. The next slide. So the Continuum of Care's interim rule really kind of lays out the groundwork. The HERTH Act of 2009 was signed into law, reauthorizing and amending the McKinney-Vento Assistance Act with changes that included emphasis on performance. The COC rule, interim rule, was published in 2012, where HUD required the continuums of care to establish and operate a coordinated entry system and process. It really charged the COCs with designing a local system to assist sheltered and unsheltered persons experiencing homelessness and providing services necessary to help persons access housing. The rule formalizes the following for the COCs as responsibilities that relate specifically to coordinated entry, coordinating or being involved in the coordination of all housing services for persons experiencing homelessness, coordinating the McKinney-Vento funds awarded within the geographic area, establishing and operating an HMIS system, and establishing and operating the centralized or coordinated entry assessment. We don't really use centralized coordinated entry. We really call it the coordinated entry, just to make sure that people don't feel like it's a one location. We have multi-sites that are designated for our coordinated entry system. On January 23rd, 2017, HUD released the notice establishing additional requirements for the Continuum of Care's coordinated assessment that requires the coordinated entry, that requires the COC and programs that are funded with CoC program funds or ESG, Emergency Solution Grant funds, to collect this data. So part of the requirement is that we have written standards that encompass these elements. It has to be a full coverage covering the entire Racine County, that it is prioritized, and we have prioritization standards in place, that it is a low barrier as possible to being able to access the system, that we agree to a housing first approach and have orientation on housing first, that is non-discrimination requirements and person-centered approach. So we're not looking at trying to make clients meet our system. It's the creating the system that works for the client's best interest. Encompassing safety planning, having standardized access and assessments that were also inclusive of subpopulations. The subpopulations that they would consider would be victims of domestic violence, youth, and veterans, as well as households with children. That we have referral protocols in place in our standards, that we're also outreaching, making sure that we're reaching persons that don't engage in services to offer coordinated entry. That we are involved in the and informing local planning and consultations. We incorporate cultural and linguistic competencies during this process, that the assessment processes and tools are reviewed, and that privacy protections and data security are also adhered to and included in our standards. And that we are using the HMIS or other data collection systems. We chose to use the HMIS as ours since the funded agencies are required to use it anyway. And it's the best tool to be able to report out data. We formed a committee known as the Coordinated Entry Committee and Work Group. And we worked in tandem with the Balance of State when we began this process. We adopted a lot of processes from the Balance of State, but we also made some adjustments in Racine to that process. We established a go live date of October 1st of 2015. So that way we can establish an urgency, and we set some expectations for all the providers included. And then we set some goals and adopted those goals from the opening doors from the federal strategic plan. The committee members included the housing providers, emergency shelter and street outreach providers, supportive service providers, providers that were funded with HUD funds and non-HUD funds. We got some feedback from persons with lived experience, as well as the HMIS lead was involved in that and continues to be involved in that. The tasks, as you can see, are on the screen. We have an implementation, creating that implementation, creating the assessments and identifying what assessment fields we wanted to capture, standardizing our prioritization and creating those standards. We had agency and staff agreements that were put into place and provided training on how to conduct the assessment and ongoing data collection, and then addressing the privacy and the policy and procedures during that were being changed. We also agreed upon keeping in mind that coordinated entry does not create additional resources or address capacity issues. It is meant to help identify gaps in services over time. It's a living and breathing process and requires evaluation and adjustments. There's been many adjustments over the last over 5 years. Some of those examples include the public health pandemic that has happened, high rates of reoccurrences. We've made some adjustments due to that, or we changed our access model as well from a no wrong door approach to a designated, multi-site designated approach. So to make sure that the data that's being collected and used in prioritizing individuals was as accurate and managed as best as possible. Here are some of the, well, most of the agencies that participated in this process and continue to participate. There were about 2 other agencies, I think that were, yes, there were 2 others that are no longer in existence and part of this, but we do have Women's Resource Center, HALO, ICA, Legal Action of Wisconsin, the Hospitality Center, the U.S. Department of Veteran Affairs, Wisconsin Veteran Affairs, Racine Vocational Ministries, Safe Haven, CVI, Center for Veterans Issues, Burlington Transitional Living Center, Hope Center, and Lutheran Social Services. Each of the agencies have signed agreements to participate in the process, having different and separate roles. And each staff member that participates has gone through training and also signed participation agreements that adhering to the responsibilities set out in the policy and procedures for Racine. The committee identified goals, and they're very common goals, that the process will be easy for clients to be able to access and provide quick and streamlined entry into the homeless services. They are referred to the most appropriate resources for their individual situation. It'll prevent duplication of services and reduce the length of time homeless and improve the community's communication amongst agencies. One of the most frustrating things, I think, if we speak to clients or persons who are experiencing homelessness, is having to reach out to several different agencies, repeating their story several different times. And the coordinator entry system is meant to be able to have their first point of contact that is an access point, being able to do that assessment and putting them on the list. And programs that are involved in it are able to pull from that list and offer services. We acknowledge as a community that there are some common misconceptions and some known changes that we're going to go on through this process. And these are some of the things that we wanted to make sure that people are aware of. The coordinated entry is not or is. So it is not a specific tool. It is a system. So it's a lot of moving parts, a lot of pieces to the system. It's not one tool. It's not what we've always done in the past, and historically it was really serving your own clients and your own programs. And now we've moved away from that process, and it's really a community's effort. It's not one agency's responsibility. It is an entire community's responsibility to provide services in this fashion. So this is the best way to be able to serve clients and meet those goals that we have. It does not fix the lack of resources, but it is an ability for us to find the gaps and needs within our community. It's also not a waiting list. One of the biggest misconceptions is once we can get on the waiting list, then we'll just wait there and try to get services. It is not that. It is what I like to call a queue, and it is dynamic. It's constantly moving. Prioritizing people with the most need. It can change at any point in time. People who are on the list are still being searching for housing and permanent housing, or even trying to get into temporary housing situations in the meantime. Any questions so far? Before I continue, I do see there might be a chat here. Okay, that was not related to this. Okay, I'm not seeing any questions, so I'll continue going. Some of the benefits of coordinated entry is specifically for persons at risk or experiencing homelessness, is that for locate their housing or service faster. So individuals don't have to go around to multiple agencies to be able to get the resources that are participating in coordinated entry, that they're only referred to the projects that they're likely eligible for based on their self-report, and they can access the projects once they are referred. So once it's referred over, so a client may have a referral in the queue, but when a program has an opening, the clients will be prioritized, and the clients that are highest prioritized will be able to access. One of my favorite things is that there is the ability for appeals if a client is being rejected or declined or denied services by a project. So with the transparent procedures, that allows a client to feel more welcome to that. And we're always supporting a client if they want to appeal a decision being denied into a project. For housing and supportive service projects, it's very beneficial that we can avoid the inappropriate, ineligible referrals for projects. Historically, I think that was really frustrating if clients were coming to a housing program and not being eligible and wasting a lot of time trying to get a client and use the resources that we currently have. It's also helps better manage the prospective project participants through prioritization. So really trying to get to the clients that we're intending to serve in our programs and helping us serve, meet our goals. Great question. We have a question about appeal and what the process looks like. So what it is that if a client is being denied services, we do have case management meetings and case staffing meetings every other month, every other week. And we are talking about clients and their process for getting enrolled into a project. And as a community, we try to make sure that all clients are, once the referral is going, that clients are being enrolled into the program. And if the program isn't able to, then we're talking as a community about why isn't the client being enrolled into the program? If it's because we haven't been able to contact the client, we want to make sure that the client is given the opportunity from even their shelter case manager to appeal that process and encourage that it's okay to appeal. It doesn't mean that the client is going to be approved, but that they're supported through that process. Our policy and procedure manual does have it written out specifically in how that appeal process works. Generally, you're starting with the agency that is denying them. And then if it's not resolved at the agency that is denying them, then it can be appealed to this continuum of care. And then I'm involved, as well as the CoC leadership is involved, to oversee and try to resolve that. We've resolved those. I haven't had any cases that haven't been able to be resolved and still offered services to the client when that process has happened. So we do have a policy and procedure on that, and it's on our shared drive, and it's part of the training process. So if you want it in writing, I can definitely give it to you, Mary Beth. Hope that answers it. All right, and then as far as what are the benefits for the coordinated entry as far as to the public and private funders as well as to the CoC, it's being able to be confident as a funder that the housing and supportive service projects are serving the intended individuals that you intend the funding to serve, that you're increasing we have been able to increase compliance and eligibility requirements through this process. Because so much of that is done through client self-report. And then there's, depending on the documentation requirements for your funds, gathering that documentation prior to even getting pulled. So for instance, we have clients or programs, that require a disability verification on file. Clients may self-report having a disability. We're engaging with those clients while they're on the list, trying to obtain that disability documentation prior to even getting pulled into a program. And working through that process. Sometimes it's very difficult for our clients who's in transient to be able to get that disability documentation themselves. So we're asking for consent from the client to be able to obtain it for them on their behalf and submitting that over to their providers to get those signatures and bring them back. And then we can hold those documents there. So if a client does get pulled into a program and prioritized for a project, it expedites their entry into the program and approval. As well as the other facet is like clients can come in and out of a literal homeless situation, being on the streets or in a shelter I'm talking about, at any given time. So with coordinated entry, the policy and procedures do have some follow-up requirements by the housing case or the shelter case managers or street outreach case managers that they're updating the client's referral every 30 days. So clients that are no longer literally homeless can be removed from the list. And so that helps with making sure that clients that are no longer homeless and a project that requires them to be literally homeless wouldn't be pulling a client that's no longer homeless into their services. Also having better access to the data and having an ability to do system or project planning based on the resources that are wanting to achieve. So as a COC, it helps us identify and improve or take actions on better outcomes. So for instance, we talked about the system performance. There's a lot of outcome-based data in there. And we also use the coordinated entry system sometimes with fundings, identify where our needs are. So obviously it helps with the compliance of the COC program and ESG program requirements and improves the fair access and ease of access to the resources, including mainstream resources. So we've improved that drastically. We've gotten, as Teresa mentioned earlier, the more engagement with the Housing Authority in Racine County. We've had WIDA with the emergency housing vouchers being included in our coordinated entry system. The VA Medical Center has started pulling from our coordinated entry system to be able to make sure that we're utilizing the vouchers that are designated for veterans into our Section 8 programs with case management. So I think that's an excellent. I think we can improve always. We even have supportive services like Legal Action of Wisconsin, doing SOAR, applications for individuals, and Racine Vocational Ministries offering case management to improve employment and income and stability while the client is in their program. Okay, allocation. It also helps the COC with having a standard understanding of who we are serving and how we are serving individuals. So just an additional benefit to that. All of the agencies have agreed to being in compliance with Housing First philosophy. The key principles of Housing First is that everyone is housing ready. So we're not requiring that clients don't meet the requirements of being able to have their own units. Everyone is housing ready. Housing ready is not housing by themselves. We want to make sure that we know that housing may look different for all different individuals. The level of support that somebody might need is very different. So it's just establishing that we know that everyone should have a house and a home to go to. That it's safe and affordable housing, and that people can achieve housing stability and permanent housing. Oh, I did mention already that it looks different. Individuals have the right to self-determination, having dignity and respect. So we always make sure that we're getting clients self-report of what they want. Clients can be offered housing, and if it's not something that meets what they would like, they are more than welcome to decline that offer and remain on the prioritization list if they are still eligible, being in a Category 1 situation. The configuration of the housing and services are based on that client's needs. Core components is that supportive services are voluntary and offered. It's not required for clients to take every supportive service program. Few to no programmatic prerequisites to permanent housing is part of that core components. That it is the low barrier admission policy, that we are rapidly and streamlining the entry into those programs. Like I mentioned earlier, we're trying to get that documentation on hand for clients that are pending on the queue or on the list, and that we have practices and policies to prevent lease violations and evictions. So Teresa did mention about how we're engaged and have hired a housing navigator to help with that and kind of working with landlords when there are issues that might arise. This gets a little technical. We talk about prioritization. This is the prioritization that was most recently as our most recent policy. It's very technical here, a lot of terms here, but this is adopted and we took a headstrong recommendation from the 2016 prioritization notice for serving individuals into permanent supportive housing, which is our highest level of need on your left-hand side. Chronic homelessness with the longest length of time homeless and has the most severe service need. When we talk about service need in this, there has been some changes about what we categorize as a service need assessment. Individuals might recall having a vulnerability index service prioritization tool, also known as the VI-SPDAT. We moved away from the VI-SPDAT as our service need, and in 2011, November of 2011, we met as a committee and decided to have a COVID response and use the indicators from the CDC and the state health department as risk factors for persons experiencing the vulnerable populations to COVID. So age factors, underlying health conditions, and being an essential worker or working away from congregate shelters. We wanted to try to minimize the spread of COVID. So those are some of the factors that were included in our severe service needs. They're each a separate level. So the first level was the first bullet point on your left. The second one is chronic homelessness with the longest history of homeless. So if someone refuses to do an assessment on their vulnerability needs, then it would still prioritize them amongst the highest, as long as there are chronic clients who are chronic. Homeless with a disability, and then the longest history of homeless. So that is trying to capture if somebody might have had maybe 3 episodes of homelessness with more than 12 months total. They don't meet HUD's strict definition of chronic. And so we're also making sure that we're prioritizing them just right below the chronic homeless individuals. So we want to make sure that we're serving persons with disability in a permanent supportive housing project. I won't go through each of those bullet points, but then on the right-hand side, you can see that there's a separate prioritization for rapid rehousing. For rapid rehousing programs, it is category 1 homeless, from Teresa's previous slide, persons who are staying in an emergency shelter or unsheltered and have had contact with street outreach, have a category 1 situation. And then we're looking at those with the highest vulnerability to COVID, which is our service need. Those have changed over time. That I want to preference in regards to that we had also prioritizations for prevention. We had a very short stance of having prevention funds in Racine. It was just from July until I want to say January where we had prevention resources. There's a different prevention assessment and scoring tool for that. We don't get large or humongous massive resources for prevention. So most of our funding has been dedicated to individuals who are experiencing homeless first. And so that was just a very short. So most of my presentation today is going to be about clients who are literally homeless trying to obtain the resources that we do have, which is for rapid rehousing, permanent supportive housing, or transitional housing programs. In our coordinated entry process, we have roles, the role of an emergency shelter. So if they are an emergency solutions grant funded shelter or motel voucher programs or other agencies that are also participating that aren't mandated, part of the requirement is that that agency does complete a pre-screen form for all of the households, that they complete the assessment tool with the individual seeking services. They refer the clients to the prioritization list in HMIS. They also would act as the point of contact and remain the point of contact regardless if that client is still staying in the shelter or on the streets. They will remain the point of contact to follow up with that. They'll continue to actively help clients secure housing. Do not rely on the housing list to meet the client's needs. Most of the clients will self-resolve, and I don't mean self meaning totally by themselves, but meaning self by paying for rent on their own or having another housing assistance program that's in the community, which could be emergency assistance from the county or a Section 8 voucher that isn't part of coordinated entry, or if they got site-based assistance. Those are all other options that aren't required to use coordinated entry. Talked about how the inflow or emergency shelter and street outreach providers have to conduct a 30-day follow-up to make sure that the client's referrals remains accurate and the client is still in contact. And that those agencies continue to attend our bi-weekly case conferencing meetings. And then the role of the housing providers that are funded is that they must take the referral that's highest prioritized on the list and screen those individuals for eligibility. There will be an email sent to me as the coordinated entry system administrator for the next prioritized referral. The housing provider attempts at least 3 times to contact the client at least 24 hours apart and documents in those notes before they would cancel or decline to serve that individuals. There's an additional stuff that's been really great with having those bi-weekly case staffing meetings is that if they aren't able to contact the client because clients might have lost their phone or not been able to respond to calls, is that they also reach out to the case manager who made that referral in HMIS. So you can definitely see that information. And at the case staffing meetings, we also talk about what might have gone on. Sometimes clients have had to be in the hospital or had medical procedures or might have moved from a shelter bed to an unsheltered situation or had a brief stunt where they were incarcerated. And so that communication is very helpful to avoid a client from being denied a program that they're prioritized for. So I think that's been extremely helpful and reducing the amount of times that clients are returning back to our prioritization list. They will attempt to contact and so they would not be able to return back. They can return back to the list if the client does become homeless again or if the categories and eligibility requirements. And attending case staffing meeting is required by the housing providers. One of the disclaimers is that we want to make sure that everyone's aware that because eligibility is different than the prioritization, once there is an opening, the responsibility of determining eligibility really belongs to a housing provider. If the household does not meet the project's eligibility requirements, the household can retain their placement on the prioritization list. So that's all a function that's trained on for staff that participate in this process so that they don't lose their place. We'll go into the coordinated entry data. First, we'll start off with a little bit about the point in time data and look at the compositions of the point in time. Point in time is not related to coordinated entry, but it is very closely kind of connected. This chart will show you the percentage of clients who are on our January point in times by household composition, households with children and then households without children. You can see that since 2018, we've been between 86 and 90% of the clients that are in HMIS as being households without children. So the majority are households without children being served. And then we fluctuate between 10 and 14% being households with children. That's just one night of the year. So just remember that. When we look at our coordinated entry list, you can see it's very similar to that. We're had a very high rate of clients prior to COVID. So in July of 2018, we were about 179 clients or households, I should say. On our coordinated entry list, we've dwindled down now, if we're looking at July of 2021, down to 59 client households on our priority list. Looks like the same, just about the same percentage of composition between, we're currently at 88% households are households without children 12% were households with children. A big help to this was one, unfortunately, the COVID, the silver lining in the COVID or the pandemic is the fact that we tried to prevent clients and diverted clients to coming into shelter and trying to find them alternative temporary housing before having to experience an episode of homelessness, trying to help those indicators. And also the resources that we were receiving through the CARES Act for rapid rehousing resources, being able to house more clients that were in literal homeless situations with rental assistance into the community. Okay, so there was a database change, and I wanted to make sure that we kind of identified prior to the database change, which happened on April 1st. We had to take a snapshot of what the data looked like. HUD also released a change in the workflow for coordinated entry. We were doing a referral-based workflow for capturing the data prior to March 31st of 21. And so now it's a enrollment-based process. So I'm just going to give you a quick snapshot of what it looked like on the day that migration happened, and then we'll look at current data in just a little bit. But on March 21st, we had 27 clients pending on our prioritization list for households without children. And that just meant the clients that did not have a rental assistance option and enrolled in a permanent housing program, there were 27 individuals that weren't offered and still were pending on the list. And then there's a breakdown of some those subpopulations. Chronic, there were 2 clients that were chronic, 6 clients over the age of 55. Our average length of time that a client was on the list of the 27 here, 240 days, with our longest length of time on the list being 722 days on the list. So this is that outlier. When we look at households with children, we had 2 clients on the list as of March 31st for households with children. Their average length of time was 110 days. The longest was 169 days. Big impact on this was trying to find units really in the community during the CDC moratorium. Until they kind of had pretty long lengths of stay there. Also, trying to work with landlords and engaging with landlords was a struggle during that time. When we look at coordinated entry historical data from when coordinated entry began in October of 2015 until that database migration happened, we had 162 clients that were accepted on that date into a permanent housing program. Of the 162 clients that were accepted, we had 116 households that moved into units. So there was about 40 something clients here that were enrolled, but hadn't yet moved into a unit in that. Some might have had units identified. We're waiting for that move-in date and to move into the unit, but 162 clients for them. Clients that were ever on the list, we had 804. So 162 out of the 804 clients, so 20% of the clients from our list since inception were offered a permanent housing program. Many of the clients, 649 clients, were canceled or declined. And when we talk about canceled and declined, that data breakdown is over here on the right-hand side, and you'll be able to see that. Many of the clients left our shelters or left street outreach and not being able to be contacted. Out of that 324 that we weren't able to contact, or those that secured housing previously, 8 of them returned to our list. Clients that secured housing on their own, meaning that they might have found an apartment and reported back to their case managers that they found an apartment when they left their homeless situation. 304 of the clients. 98 of the clients went to temporary housing situations, living with family and friends on a permanent basis. When we call permanent basis with family and friends, we mean that the family or friends did not give them a time limit on how long they were allowed to stay there. They were allowed to stay there without a notice of having to leave. 13 clients for households without children had obtained Section 8 vouchers, and we had 9 deaths in total while clients were waiting on the list without being offered a housing option. Households with children, we had 68 clients out of the 216 that were ever on the list were accepted into the program. 54 of the clients had moved into permanent housing at the time of March 31st. 149 of the households with children's referrals were canceled or declined. Given these reasons, we can see that 57 of the clients were unable to be contacted. 43 clients ended up finding housing that wasn't within a program subsidy. 14 went to temporary situations, living with family and friend on a permanent basis. 7 households obtained Section 8 vouchers, and we did not have any households with children that passed away. 1 client returned to our list. I see some questions in the box, so let me make sure I'm seeing it. Yes, this is Racine County data specifically, just within Racine County. Perfect, okay. Sorry if I'm not seeing those chats right away, I apologize. All right, so then we'll go on to some more data here. As of December 9th, I ran this prioritization list. We have 37 clients that were pending on our prioritization list. 1 client being chronic, 2 being youth between 18 and 24, 13 clients over the age of 55. Our average length of time has changed now that the CDC moratorium's over. We've been able to house many more, and having more rapid rehousing resources available has really helped here. We have 107 days. That is on average clients on the list, but we now have increased that length of time for the longest stayer on our list, 975 days. Households with children, we have 5 households currently on the prioritization list that have children. 1 is an 18 to 24-year-old. The average length of time on our list is 23 days. So that's within our current metric of trying to have less than 30 days that families experience homelessness. And then 48 days is the longest one of the 5 individuals are on the list. When we look at gender composition by these household referrals, of the households with children, all 5 households with children are female-headed households. For our households without children, 68% of the clients that are on the list are male heads of households, and 12 households are households headed by females. So total flip-flop between the households, which I think is something we would expect to see. Race composition, listed all the categories of race that we capture. 13 of the 37 are households without children are Black, 20 are households without children that are female, that are white, and 4 multiracial. So it could be a multitude of different races, as long as it's more than 1 race identified here. When we're looking at households with children, we have 2 households of white, heads of households, and then 3 households. 3 households of white and 2 are Black. Ethnicity, looking at whether or not someone is Hispanic or Latinx. Households with children, no one identified as being Hispanic. We have 2 households without children that are Hispanic. The remainder were non-Hispanic. Now our outcomes since migration, so we looked at the outcomes from 2015 until March 31st. These are outcomes based off of our current prioritization list as of the report run on December 9th. We had 61 clients that were accepted into programs out of the 140 referrals ever on the list during that time. 40 were accepted and moved into housing. 58 were canceled. And again, these are our reasons for canceling. The majority of our clients either self-resolved or whereabouts were unknown. Clients could have been offered services and then denied those services. Either they were denied by the provider or denied by the client. Sometimes by the time the referral gets over to the agency, they're attempting to contact the clients. 8 of those clients were not able to be, did not show or weren't able to be contacted. 5 have other reasons for denial. I'd have to look into that a little more to find out what exactly those reasons for denials were under other. But 2 of the referrals, the clients ended up obtaining housing prior to actually being screened for an enrollment into a program. We currently have, out of the clients that are pending with a program enrollment, we are currently looking for 8 units that have permanent housing offers in hand, and just trying to identify units for those individuals. Looking at the households with children, there were 28 households with children ever on the list. 19 of those households were accepted into programs. 10 have moved into units. Many of them were already identified units. I think they're encompassing into this 8 if they didn't have a unit identified. And then the reasons why they were canceled, as you can see, many of the clients end up having this. You're seeing a big difference in our last data here, that we have a lot larger percentage of clients that are being offered resources, and this had to do with the CARES Act funding that came through. So been able to help us provide housing resources to clients. And when we look at what does Racine County need right now, and we'll probably say this many more times, landlords willing to lease units to permanent housing program participants, and even our self-paying clients who are self-paying their rent. So getting landlords on our over to our housing navigator and her being able to explain the programs is extremely helpful. And then looking at maybe having some risk mitigation funds to be a tool in the toolbox for our housing navigator. So when landlords are reluctant to provide assistance, is being able to offer stronger security deposits or have a funding pot in the event there was some small damages that were done to a unit and landlords are upset about it, that can be tapped into. That would probably have to be with some private funding or creative funding. But those are 2 things that I think would be extremely helpful. So right now we have 13 permanent housing participants that need units. 4 of the participants have DASH vouchers that has case management and supportive services tied to it, and a case manager that's working with the person. We're looking for 4 units for those individuals. We have 5 households that have emergency housing vouchers, Section 8 vouchers with some limited case management involved that we're looking for units for. And those were Section 8 vouchers with WIDA. And then we have 4 rapid rehousing case participants that are looking for units as well. So a total of 13 units would be extremely helpful if we can find some landlords willing to take participants with those resources. If you know of a landlord or an property manager, please, that we should reach out to, please email Becca Pritzel, our housing navigator. Her email's here. That contact information, she would love to follow up. All right, I'm going to questions now. Open it up for questions. I do see there's one question in the box. I just want to clarify, but the best way to get someone experiencing homelessness onto the prioritization list is to refer them to the No Wrong Door organization. Is that correct? So in Racine, we do not have a No Wrong Door or approach to coordinated entry. Our approach in Racine is a multi-site designated sites that are trained, staff are trained on conducting coordinated entry. So for clients that are staying are unsheltered or are sheltered, and when I say unsheltered, I mean staying in places that are not meant for human habitation. That could be staying in a park or on the bench or in their vehicles. Those individuals should be referred over to Hope Center. Hope Center has trained staff to conduct coordinated entry and engage those clients first for crisis interventions, trying to get the clients into a sheltered situation if that's what they want. And then if they choose not to, Street Outreach will continue to work with them and offer coordinated entry to the individuals. So making that referral for those. If they're in a shelter, making sure that they're aware that if you have a client, that they're aware that they should be in contact with their case manager. The case manager can confirm whether the client is on the prioritization list or that they should ask the case manager to be added to the prioritization list if they are in the shelter. Great question. Any other questions or clarification needed?
Hey, Arita, it's Tamara again. What about clients staying in hotels? What's the best? Like, we have clients that are staying in hotels that obviously they're not category 1, right? So
Correct.
that
If
would be
they're-
category 2.
Yeah, if they're staying in a motel, are they paying for the motel themselves or a family member
Yeah.
paying for them, or if it's an
Yeah,
agency?
yeah.
So if it's paid by themselves, it's really considered temporary housing. It wouldn't be
Okay.
our category 1 for the homeless list. If we were to have prevention resources, it would be there, but I would really strongly suggest them going over to Here to Help to get screened for WERA or Community Action Agency for the WERA funding.
Okay.
If they're
actually
not able to
that's a
pay for
good-
that motel.
Okay, so that's a good point. So like that, so Here to Help would be like the point of entry for Community Action and WERA and other agencies. Like they would connect them to those or not.
My understanding is Here to Help is doing some soft screening for WERA
Okay.
resources. If there's anybody on the line that knows more about how Here to Help is connecting with the WERA funds at community action agencies, please feel free to chime in. But yeah, that is going through that program. WERA funds were not required to be involved in the coordinated entry process, so that's independent. Kind of like even emergency rentals, emergency assistance to the county as well.
Okay, because I would assume I could refer them right to Community Action, but that I was just wanting to know if there's a different way.
Yeah, I would do them both.
Okay.
I don't know anybody else.
Tamara?
Teresa, I don't know. Do you
Yeah.
have more on that?
For the WERA program, there's actually on their website, there's actually for Community Action Agency that you can register through there, or they have a phone number that they can call if that's what they're looking for directly. Here to Help if you're in Racine County. The good reason to contact Here to Help is because if they're having problems with rent or they may be eligible for something such as food stamps. They may be eligible for energy assistance, so even once they're caught up and they're accepted, there might be a few funds available within the Racine County, but again, that's kind of limited. But connecting to Here to Help and WERA could benefit them, because if they're eligible for the WERA, then they get the rent assistance and they can, but through Here to Help, then they've also got, do you need energy assistance for you need your utilities? Do you have problems with whatever else is going on? So it's kind of a way to catch all different areas where they might need help.
Thank you.
Great question. Thank you for asking. Anything else?
Actually, I do. So is there programs and do we keep data on people coming out of incarceration that are needed into housing? I'm assuming you do, but I didn't hear that if there is. And then what programs maybe are available for people who are coming out of incarceration?
I can say that in regards to data, so if a client comes from an incarceration, an institutional setting, I should say, that is captured in HMIS, and we can look at that data when we're looking at the system performance measures. Mostly when it comes to us looking at the longitudinal system analysis report, in HDX, the repository, we can drill down and look at some of that. So System Performance Committee is the committee that would probably best fit looking at that data set. As far as resources to help individuals leaving an institutional setting to get housing, unless they're leaving maybe and then going straight into a shelter, they would just be on our coordinate entry list. If they were on our coordinate entry list, like they were sheltered and then went to an institutional setting where they're less than 90 days, they would still be on our priority list. But once they hit more than the 90 days, then they're kind of taken off our list because they're no longer fitting HUD's definition of homeless. And then that's DOC's whether or not they're actually, how long they're actually serving their time. And then when they leave that situation, they can come back. But I don't know if WERA's doing any funding to help persons that might be leaving institutionals or like a TLP program. Does that make sense? But we're not offering prevention services, so.
Got it. Could I contact that committee to get kind of that data? Because I've been looking into if there's grants available for that population specifically.
I think it would
see
be-
what numbers we have coming out.
I think connecting with Teresa would be best. She can,
Okay.
depending on what date and what date range, she'll probably need some
Okay.
parameters to kind of capture what is available, what specifically you're looking at. But or sitting on the committee is helpful too.
There is, Racine Vocational Ministry also has programming for people that are returning into the community after being incarcerated. So, and that's a good spot, good connection for them. And Tamara, if you want to get together and talk about this, I would love to have a group that looks at the criminalization of homelessness, looks at people that have been incarcerated and bringing them back into the community and how that relates with homelessness. So definitely something we could move forward on.
Yeah, absolutely. I can reach out to you about that for sure.
Okay, sounds good. Are there any other questions for Rita? Okay, hearing none. This is where we move to our community sharing part. And thank you, Arida. That was very informative, very in-depth, and I'm hoping that people are able to see what goes on behind the scenes with all of this, trying to get people to the right program for them and to consider their needs as well as what the community is requesting that we do.
Thank you.
Becca, are you still, Becca, can you put your camera on?
Yes, I can. Hi.
There's Becca. Becca is our housing navigator now. And she's working with HALO, she's working with other agencies, and she's also working with our emergency housing vouchers through WIDA, helping people get their packets together and get some things going. So welcome, Becca.
Thank you.
Just to put you on the spot a little, are there any concerns or any issues that you find popping up with looking for housing?
Lack of availability of 1-bedrooms, because a lot of people are looking for 1-bedrooms, and then trying to find units that fit the parameters of the programs, meeting the fair market rent, somewhere nice for folks to stay. And then of course, landlord challenges with questions about how the programs work, or someone, you know, that's exiting from homelessness into housing and what kind of supports they would need and how to help support them into that housing unit.
Mm-hmm.
Yeah.
Okay, thank you.
You're welcome. But it's nice to meet everyone. Thank you.
Okay, next up, community sharing. Does anybody have any sharing they would like to? Any events coming up? Anything?
Hello, this is Mary Beth. I just want to give a shout out to Sharon because I believe this is her last meeting before she
Yeah.
retires. So thank you, Sharon, for all your volunteerism here at the Alliance. So thank you very much.
Yes, Sharon.
Thank you, Mary Beth. And I just want to say it's been an adventure. It's been informative and a big learning curve for me working with everyone in the coalition over the years. You all do great work, and I know that you will continue to do so. So thank you all very much.
And with Sharon leaving, not only will we be needing somebody to be a secretary, but we'll be needing someone to either move the motions or second the motions, because Sharon's usually the one that pops in when everybody's quiet. So. Okay, any other programming, anything going on, any fundraising, anything you want to share?
This is Tamara. I have two things. First, I have a question. Who has access to Becca, like as housing navigator? Is it the CoC? For instance, I have clients that are, have reunification plans and need to find housing in order to get their children back. And if they're having issues, with landlords or finding adequate housing, like who has access to the housing navigator to help with that?
I can definitely answer that if that's okay with you. Becca's role is really funded by a private foundation funded to HALO. So the primary scope of the clients being served are persons that are in shelter at HALO or clients that are receiving rental assistance programs from one of our community partners that receive CoC or ESG funding. So it does have to be through our coordinated entry system at this point.
Got it.
It would be great if we had multiple housing navigators that can kind of do more work, but we have to be able to prioritize her work. She's one person.
Yep.
And
We'd have to be able to pay for it.
yeah.
Yeah.
So yeah, but great
Got it.
question.
Thank you. And then my second thing is, if anybody is working with the LGBTQ community, the Patent Law Office has started the Avery Project. So if there are trans or non-binary individuals that that need help and possibly funds going through the legal system of changing names, please send them our way. I just wanted to throw that out there if you happen to know anybody or spread the word about that. So. Because it costs like upwards to $600 to get your name changed. So,
Okay. Have you connected with the LGBT Center?
Yep, and
Okay.
Kenosha Pride and everybody too. I just wanted to know. I know there's populations that you work with as well here. So,
Sure.
if that's something that they're working on.
And also, if people haven't signed in the chat who you are and who you're with. If you're not representing an organization, just put that you are a community advocate. But if you are part of an organization, please put that in there so we can keep tabs on who's coming to the meetings and that. Okay, any other updates? I hear none. Well, okay. I guess we need a motion to adjourn.
Okay, this is going to be my last one.
That's what I was hoping for, Sharon.
I make a motion that we adjourn the meeting. Thank you.
Thank you, Sharon.
Can we have a second? Can we have a second?
I second.
Who is that?
This is Mary Beth. I
Oh,
second
you're-
Sharon's.
Okay. Very good. Well, all those in any objections?
No.
I assume there's no abstentions. And so at this point, we're going to say all those in favor, please go ahead and log off.
Okay.
Thank you for your
Thank
time.
you.
Thank you.
Thanks, Sharon.
Bye.
Nice working with
Bye.
you.
Thanks, Jeff. Appreciate that.